Welcome back everybody. We're doing a video series on managing symptoms of COVID-19 at home. This series of videos looks at mild or moderate symptoms of COVID-19 infection that can be looked after at home. And in this particular video, we're talking about the fever. Stay tuned.
Hey now, take a step outside and seize the day now. Set aside your worries, it's okay now. The sun is here to stay.
Hi there, I'm Dr. Sylvia and this is Askawayhealth, where we provide you with direction and clarity about everything medical. Please subscribe to the channel, and when you do, don't forget to click that notification bell so that every time we publish a new video, which tends to be once a week on Saturdays, you will be aware of it. So a fever is just another way of saying a high temperature. Fevers happen most commonly as a result of infections in the body, but there are some different conditions that can cause the body temperature to go up. And one of the common symptoms of the COVID-19 infection is the presence of a fever that is a temperature above 37.8 degrees centigrade, which is about 100 degrees Fahrenheit. In the absence of a thermometer, you could tell that someone has a temperature by feeling their chest or their back using the back of your hand. In addition to having the fever, many people with the COVID-19 infection have also described having chills, that is feeling very cold despite having a high temperature, and experiencing an intense shaking of the entire body that is also called rigors. Now, interestingly, fevers generally could have a beneficial aspect in terms of managing infections by the body. For example, it is thought that having a fever serves as one of the body's natural infection fighting mechanisms against germs that cannot survive at that level of a temperature. The other benefit is that some scientists believe that the body's defense mechanisms actually tend to kick in or even work more effectively at that elevated temperature. So, like I said, many people with COVID-19 experience high temperature, different ranges. In addition to the temperature, there are some other symptoms that can happen. For example, a headache, muscle and joint aches all over the body, so people end up complaining about pains in the arms or the elbows, the back, the hips and the knees, or just feeling achy all over. They might sweat from time to time or just sweat profusely all the time they have the fever. They might also experience a very fast heart rate or experience the heart skipping or palpitation. Other features of the fever will include general weakness, a loss of appetite and fatigue. Now, we know that the fever in the COVID-19 infection could occur at the very beginning of the illness, but in some people we have seen that they may go a couple of days before the fever starts. Now, what's the remedy if one develops a high temperature and other symptoms and is thought or suspected to have a COVID-19 infection? Okay, the first thing to do is dress in very light clothing. Next, anti-fever medicines like paracetamol, which is also sold as Tylenol or as acetaminophen in other areas, is effective in lowering the temperature for most of the cases. Reports have emerged regarding the use of another common antipyretic medication, which is the non-steroidal anti-inflammatory drug ibuprofen. It was initially thought that there were some adverse effects experienced by people with COVID-19 who used ibuprofen. It wasn't very clear if it was ibuprofen that was directly responsible, so the recommendation from the World Health Organization was that in the absence of any verifiable data, they were not stopping the advice for people to use ibuprofen. However, most health authorities, from an abundance of caution, have simply recommended that if somebody is suspected to have the COVID-19 infection and the temperature, do not use ibuprofen. Now, if you're one of those people who has an allergy to paracetamol or for some other reason cannot have paracetamol, please speak directly to your medical provider so they can look at your history and consider other suitable alternatives or advice on what you should best be using. Most times, using the method of exposure and taking the paracetamol as recommended by the manufacturer will help to settle the temperature for a few hours, but during the course of the illness it might come back again, and so you might need to have regular doses dosing of the paracetamol to control the temperature. In addition, the paracetamol can also help with some of the other symptoms that I listed earlier, which sometimes accompany fever. You know, the muscle aches, the feelings of tiredness and dizziness that occur alongside the fever. Now, another very important thing that we must do if we have a temperature is to make sure you're drinking plenty of water. Don't forget, we talked about experiencing excessive sweatiness, and so that's the method by which the body loses fluid when the skin is overheated. So being hydrated, taking plenty of water helps to replace the fluid that's been lost through the sweat, and it also helps to improve one's general feeling of ill health when the body is not dehydrated. So that's it on fever and how it can be managed in COVID-19 infection. If you have any specific questions about this or you have anything to add to this, let me know in the comments. And if you want to send any private inquiry, please send an email to info@askawayhealth.org. Don't forget to like this video if you found it helpful, and please share, and don't forget to subscribe to our channel. We're really encouraged by the increasing number of subscribers. Thank you so much for the support that you're providing for us. So stay tuned. We're going to the next video, where we'll be talking about some of the other symptoms of COVID-19, and if they're moderate or mild, how you can successfully manage them at home. I'll see you in that one.